Hello, good afternoon, and welcome to our very first live virtual lunch meeting of 2021. My name's Alec, I'm MD for Wound Care People, and today's event is brought to you in partnership with L&R, and it is called New Year, New Foam, redefining what silicone foams can offer patients and the NHS. Today's speakers are Charlotte Furness, who's the commercial manager for L&R, and Fiona Fox, clinical advisor for L&R. Charlotte and Fiona, are you both there?
Yes.
Hello.
Hiya.
Hello, both. So the way this is going to work is I'm going to hand over to you in just a moment. I've just got a tiny little bit of housekeeping, which is that certificates are available for attending the event. You'll have a link for those available in the comment section, which will be added a bit later. We've sent out, a lot of you would have requested some samples for today, so I think Charlotte is going to mention when you're going to need to get those out and use them. Please do ask as many questions as you possibly can. You can do that just through the comment section. Without further ado, I'll hand over to Charlotte, who's going to start today, and I'll be back to join you both for the live Q&A. Okay, thank you.
Thank you, Alec. Thanks for the introductions. Hello, everyone. As Alec mentioned, I'm Charlotte. I'm commercial manager here at L&R, and alongside my clinical advisor colleague, Fiona, today we're going to be sharing with you how we can redefine what silicone foams should offer the NHS and your patients. So we wanted to make today's virtual lunch meeting with you as interactive and as relevant to the clinicians in our audience today as possible. And that's because we know that silicone foams are such a widely used product across wound care practice. And with the launch of our new silicone foam, Suprasorb P sensitive, we really wanted to be able to redefine what silicone foams can mean for you as clinicians and your patients. So to do that, we thought a really good place to start would be to have a really good understanding of the current situation. So when you registered for the event today, we asked you to share some feedback with us. And what we wanted to find out from you was, what do you think of silicone-based foams? What's good about your current foam or foams that you've used in the past? And if you could, what would you like to improve? So thank you to everybody who shared some feedback with us on registration, because it's really helped shape the virtual lunch meeting for us today. So the first thing we wanted you to share with us was what's important to you when using a foam. And there was such a wide variety of answers to this question, which really kind of confirmed to us that silicone foams have got to satisfy a variety of measures. But two of the most common needs that you shared with us that were needed for when using a silicone-based foam was that it needed to be easy, so easy to use, easy to apply, easy for your patients to wear, but also absorbency was really, really important. Some of the other features that you shared with us that you felt was important when choosing and using a silicone foam is that it needed to be gentle on fragile skin, it needed to be conformable, it needed to be atraumatic in its application and removal, it needed to be soft, and some of you even shared that price as well was important. We also wanted you to share with us what could be better in the current silicone foams that you're currently using. And again, we had such a wide variety of responses to this question, which absolutely, showed to us that when using a silicone foam, it has to be an all-round strong performer. But interestingly, you shared with us that one of the most important features for you when using a silicone foam is that it needed to be absorbent. But actually, when we asked you what could be better in the current silicone foam that you're using, absorbency was one of the main things that you fed back to us. Another common answer that you shared with us was not sure. So that kind of meant to us, does that mean that you don't usually get the opportunity to see if other foams perform better? Some of the other features that you felt could be improved was conformability, the range of sizes that you have within the range, patient comfort, whether it's showerproof and waterproof, its adherence when in situ, and also some people reported back that price could be improved as well. We also wanted you to share with us what types of wounds you're currently using silicone-based foams on. And this is because we know that silicone-based foams are suitable for such a wide variety of wounds. And if we're trying to redefine what silicone foams can offer you as clinicians into your patients, is this versatility maybe one of our biggest challenges? But two of the most common things that you shared back with us, that you would use silicone foam dressings on skin tears and also ulcers in general. So some of the types of ulcers you'd be using silicone foams on were leg ulcers, pressure ulcers, diabetic foot ulcers, Some of you shared that you would use foams on burns and post-operative wounds. But also interestingly to this question, there was quite a few of you in the audience who, instead of sharing back what types of wounds you'd choose a silicone foam on, you reported to us what levels of exudate you would choose a foam to be used with. So as you can see from the graph, many of you fed back that you would use a silicone foam dressing on low to moderately exuding wounds, but actually there was quite a few members in the audience who would also use a foam dressing on moderately to highly exuding wounds as well. So really to round up, we wanted to hear from the clinicians in our audience today what was the kind of the must-have features when using and choosing a silicone foam for your patients. And the absolute standout important feature was effective exudate management. So how absorbent is your foam that you're using? Really closely followed by softness and comfort for the patient. So that was absolutely up there with, you know, one of the key most important things. Another feature you fed back was dynamic protection, how well it protects against bacterial barrier, and atraumatic removal was also really important to you as well. But as well as these sort of key features that you found in a foam, you also reported back to us that price still plays a really key role in when choosing and selecting the right silicone foam for your practice. So in summary then, you shared with us that you need a foam that will suit a variety of situations and exudate levels. You need a foam that's going to be soft and atraumatic for your patients. It needs to be easy to apply. It needs to conform to the patient and adhere suitably. And we need to be providing you with a choice of sizes and shapes. So thank you to everybody who shared the feedback with us when you registered for the event today. It's really helped shape what our virtual lunch meeting is going to bring to you. I'm now going to hand over to my colleague Fiona, who's going to introduce you to Suprasorb P sensitive.
Thanks, Charlotte, and good afternoon, everyone. I think that's been really helpful to get a flavour as to what types of wounds clinicians are using silicone foams on, what you like about what you're currently using and what you would see improved if possible. We've already heard how popular they are, mainly due to their versatility. And indeed, they are a great product, a great type of wound dressing for the right patient or the right wound at the right time, because they offer that absorbency and protection for a variety of wounds, including wounds like Charlotte's already mentioned in terms of chronic wounds like leg ulcers and pressure ulcers, but also on acute wounds in terms of the surgical wounds and traumatic wounds like skin abrasions and skin tears, and really across the spectrum in terms of depth of wounds. So we see them used on superficial wounds really effectively and in conjunction with primary dressings on deeper wounds. But there are certain things that we've come to expect from a silicone foam dressing that it's going to offer, you know, yourself and your patient, and that is that it's going to protect and promote a moist healing environment by absorbing that excess moisture and protecting the peri-wound tissue. And as Charlotte's already mentioned, exudate does play quite a key role in terms of when we would select silicone-based foams. So they're generally indicated for wounds that have a low up to and including a moderate level of exudate. And then thinking about products like super absorbent dressings or super absorbers for those more problematic wounds that have got those much higher levels of exudate. We also expect that the dressing is going to ensure that it provides protection of the epithelial tissue by being soft and gentle, and of course providing that all-important atraumatic removal upon dressing change, which also obviously ensures that the patient's comfort is achieved as well and optimised. In terms of comfort for your patient, we also would expect that the dressing is practical to wear for their everyday quality of life, include protection from fluid bacteria. So it's my great pleasure to introduce you to Suprasorb P sensitive, and we are able to provide you with this dressing and are confident that it's going to give you confidence for ensuring that you get that efficient exudate management due to its high absorbency and high MBTR. That it's going to provide that all-important softness and comfort for your patients because of the built-in octasil technology and the 2 layers of foam, and that it's going to provide the patient with that everyday dynamic protection against fluid and bacteria, but also helping to ensure that we prevent those lateral shear forces. And we have happy to share robust independent data for all these statements in terms of how Suprasorb P sensitive functions, and we're more than happy to share that with you. So please feel free to contact us if you'd like more information on that. I'm now going to hand you back over to Charlotte, and she's going to go through a practical demonstration of Suprasorb P sensitive. So I'll see you again very shortly.
Thank you, Fiona, and thanks for introducing us to Suprasorb P sensitive, and we'll look forward to hearing more about that later on in a session. But as I mentioned when we started the session today, we want to make our first virtual lunch meeting with you all as interactive and I suppose as close to, you know, what a normal lunch meeting would be. So now we've got an amazing opportunity to be hands-on with Suprasorb P sensitive in an interactive demonstration. So as I mentioned, for those of you who registered for a virtual lunch meeting pack when you registered for the event today, now's the time to get the dressing out of the pack, and we can you can join in whether you're at home or at your workplace, and we can do the demonstration together. For those of you who didn't get a chance to order a virtual lunch meeting pack, there will be an opportunity to do so later on. So please do take us up on that. So what I'm going to do first then is just take you back to the first part of our session today, when we talked about what was the most important features for us when we're using silicone foams with our patients. And the main headlines that you shared with us is that effective exudate management was really, really important. So it had to be really absorbent and be able to handle fluid. It had to be easy to apply and easy to use, and softness and comfort provided to the patient was also really important. So for the purposes of our interactive demonstration today, let's keep those three main headlines in our minds while we're looking at Suprasorb P. So for those of you who are joining in at home or at your workplace, now's the time to get the dressing out. So I'm going to get Suprasorb P sensitive out here, and the first thing that we can do together is just feel the quality of the dressing, kind of feel how soft and how flexible the dressing is, and just have a bit of a first look really of how we feel that the dressing kind of looks and seems to us. So one of the main things that you shared with us is that Suprasorb P sensitive, or the foam that you're choosing, needs to be easy to apply. So Suprasorb P sensitive has a 3-tab backing feature, and this really helps with a slick and easy application. So I'm first going to take off the first of the 3-tab backing, and I'm just going to be able to hold the dressing really simply with the remaining 2 tabs in place. And what this allows us to do is it allows us to hold the dressing without any of the silicone border sticking to our gloves or, you know, rolling up around the edges. And it just means that we can position the dressing or reposition it where it needs to be without any interference to that sort of the more sort of adherence border. So once we've got the dressing in place, we just position it where it needs to be. And now really easily, you just have to remove the remaining 2 tabs, and as you can see, the dressing goes on really nice. There's no rolling up of the edges or anything like that, and it smooths into place. So we hope for everybody who's joining in at home or at your workplace, you can feel how nice and easy that was to apply, how conformable it is now it's in situ, and how soft and comforting that might be for the patient as well. So I'm going to leave that dressing in situ now while I get the second dressing that I've got available. And now we're going to focus on the most important thing that you shared with us, which was effective exudate management. So I'm sure we're all used to doing this in our normal lunch meetings that you know we may have had together in the past. But what I'm going to do is to demonstrate how Suprasorb P sensitive handles the fluid capacity. I'm going to use some substitute exudate. So what I'm going to do, and absolutely join in if you can do at home. You may not have substitute exudate, but water's absolutely fine. I'm just going to pop some drops on the dressing, and as they go on, we're just going to see how well Suprasorb P absorbs the exudate. So we have some amazing evidence on file which proves that Suprasorb P sensitive is really competitive with regards to its fluid handling capacity. We'd absolutely love to share that with you after the session if you'd like to find out some more. So we can see where the Suprasorb P is really absorbed and wicked away the exudate within the dressing. And I hope that when you're joining in at home or at your workplace that you know, you've been able to see that as well. So what I'm going to do now is just to finish off the virtual demonstration today would be just to remove Suprasorb P sensitive. And this is done in exactly the same way that we would always remove a silicone foam, a silicone bordered dressing, which just edging away the edges and gently removing the dressing from the peri-wound area. So Suprasorb P sensitive has octasil technology, and that really helps with an atraumatic dressing removal. So I hope everyone enjoyed our interactive demonstration today. For those of you who joined in at home, please do share with us any feedback that you might have in the comment section. We'd absolutely love to hear from you. For those of you who haven't got a virtual lunch meeting pack and would like to get your hands on Suprasorb P to have a go at a demonstration yourself, then as I said, there will be an opportunity for you to get your hands and order one later on in the session. So thank you. I hope everyone enjoyed that at home, and I'm going to hand back over to Fiona.
Thanks, Charlotte. Again, I'm sure that everybody who's joined us on the meeting today has found that really helpful to see how easy Suprasorb P sensitive is to use and how it absorbs exudate so quickly. So some of you that have used silicone foam dressings before, or other types of dressings that you're familiar with that have a layered technology, Suprasorb P sensitive offers 5 layers, which all play a role in either absorbing that exudate, distributing the exudate evenly, and locking that exudate away, particularly in terms of chronic wounds, when we know that exudate is more corrosive and damaging to the wound and the peri-wound tissue, and then finally releasing the moisture to maintain that optimum wound environment. So starting with the first layer, whoops, that was a bit quick. The octasil silicone wound contact layer allows for effective absorption of exudate into the dressing, and because of its soft and low adherent silicone, allows that all-important atraumatic dressing removal. So ensuring that the patient's comfort is optimised, but also ensuring that any new epithelial cells are left, intact. The absorbent foam layer, as well as providing comfort and a cushioning effect for the patient, the foam layer starts to absorb the exudate immediately. And then in conjunction with the non-woven layer, this really effectively distributes that exudate, maximising that absorption efficiency. But also that non-woven layer then frees up the foam layer beneath it to allow it to absorb more exudate as it's been produced by the wound. The exudate is then absorbed again into the second foam layer, which acts as a superabsorbent core, as it contains superabsorbent polymer fibres. And as you'd expect with a dressing that contains superabsorbent polymer fibres, it helps to really lock away that exudate and leave that, that wound bed having sort of a much better chance of improving and not being damaged by that corrosive exudate, but also ensures that we're locking that moisture away to reduce the risk of maceration. Finally, the protective backing. This is an independent external backing layer that allows the rest of the dressing to move with your patient. So as your patient moves, or if they knock the dressing, it really helps to reduce the risk of those lateral shear forces that could otherwise damage new epithelial tissue or actually cause the patient discomfort. So not only does it protect that new epithelial tissue, but it also optimises your patient comfort in the long term. The backing is also breathable with a high moisture vapour transmission rate, again ensuring that you've got the optimum wound healing environment. It's clear to allow monitoring of exudate without unnecessarily removing the dressing. As we've heard and seen, it's also smooth and conformable, and it provides that all-important fluid and bacterial barrier for your patient. Suprasorb P sensitive is available in a wide range of shapes and sizes that will meet all of your clinical challenges every day. The standard size is available in 5 different, standard shape, is available in 5 different sizes. And then we have an anatomical shape range in terms of 2 sacral shaped dressings, a heel and a multi-site. We also have a non-border and border light variety, again, that are available in various different sizes. So I'm sure that there's something there to meet any of your needs on a daily basis. It's always really great to be able to provide some feedback from clinicians that are already using Suprasorb P sensitive. And this is a quote that we received from a tissue viability nurse in the Isle of Wight who switched their previous foam to Suprasorb P sensitive towards the end of last year, and he's written to us and said that the dressing is easy to apply and does everything you need it to do. patients report that it's very good level of comfort, and after initial application often forget they have it on, which I think, as Charlotte was saying earlier on, one of the key things that that you wanted from that dressing is to ensure that patient comfort is optimised, and I think this sort of demonstrates that really well. A new product usually brings some grumbles or complaints, but we have had no negative comments at all on Suprasorb P Sensitive. Hannah has also written to us, and she's also saying that they've switched to using Suprasorb P Sensitive. They love it. It holds the exudate really well and is so gentle on the skin. We prefer it to our previous foam. And I think, again, one of the key things was how a dressing product, this type of dressing product, would ensure that we get that efficient exudate management. So that's really good to hear that she's seeing that for herself. And I think it always is good to share these clinicians' feedback. So choosing Suprasorb P Sensitive for patients, for you and for the NHS, I think we've been able to demonstrate that Suprasorb P Sensitive is a highly effective dressing choice for your patients in terms of offering efficient exudate management due to its high absorbency and high MBTR, but also that it provides your patients with the softness and comfort due to the octasil technology and the 2 layers of foam. And ultimately that it provides that everyday dynamic protection by ensuring that it provides that fluid and bacterial barrier, but also helping to reduce and prevent those lateral shear forces that could damage new tissue and ultimately provide discomfort for your patient. One thing that we haven't mentioned, I'm sure if we were attending our usual lunchtime meetings with you face to face, we wouldn't be getting out the door without somebody asking, well, this sounds like a great dressing for our patients. It sounds like it ticks all the boxes that we want from a foam, a silicone foam, but what's the catch? And I'm likely to guess that the catch is going to be cost. So not only does Suprasorb P Sensitive offer that highly effective dressing choice for your patient, but it also provides you with a highly effective and cost-effective dressing in terms of your budget. And I'm sure that anybody that would like to have a look in a bit more detail in terms of the potential cost saving that you could make by using Suprasorb P Sensitive, then again, please do feel free to get in touch at the end of the meeting or whenever it's convenient to you, and we can have that one-to-one discussion. As Charlotte's already mentioned, and I think Alec as well, for those people that didn't request a sample today, but you're reaching to get your hands on this great product, it's not too late to request a sample. There will be a link available that you can use to request your sample and information pack. And I think now all that leaves me to say is to thank you to Charlotte for joining me today. Thank you to everybody that's joined us out there on the meeting. We really do appreciate the time that you've taken out of your day to come and attend our first virtual lunch meeting. And thank you to the JCN and to Alec as well for hosting the session today. So I'll hand back to you, Alec.
Thank you, ladies. I thought that was really, really interesting. I know that we've had lots of questions in throughout the event. I've been keeping an eye on those. The first thing I'd like to say is just to you, Fiona. I think I got your name wrong at the start. So that was, I think that was the first event of January. So I don't think we've all warmed up just yet. So apologies for that.
No problem at all.
We are going to go straight on to the questions because I know there's quite a few of them come in. And this first one is for you, Fiona, and it is, what's the wear time of the dressing?
So Suprasorb P Sensitive can be left in place for 7 days or up to 7 days. However, like with all patients, that will depend on the amount of exudate that's produced and other factors that may be, that we may be considering within the wound. So we would expect that within that 7 days, even though you might not have to change the dressing, that you would certainly go back and inspect that patient's dressing to make sure that that the wound is still how you expect it to be, that the exudate hasn't increased, and that you do need to change the more frequently than what you first thought.
Okay, thank you. The next question is for Charlotte, and this is the dressing available on prescription and other supply routes?
Hi, Alec. Thank you. Yes, it is. So Suprasorb P Sensitive was launched onto a drug tariff on the 1st of October. So it's available through prescription, it's available through all pharmacy and wholesalers. If within your trust you use an off-script system, then we'd welcome, if you want to get in touch with us, we can discuss how we can look at organising that access for you as well.
Okay, brilliant. Question number 3, this is from Nicola. It says, is the dressing suitable for patients who have very fragile paper-like skin? And this is for Fiona.
Yeah, that's a really good question, actually, Nicola. Thank you. So the name of Suprasorb P Sensitive is called Suprasorb P Sensitive because the P stands for polyurethane foam. However, the dressing, in terms of the word sensitive, doesn't mean that it's just suitable for patients that have fragile skin. It can be used across the board, but certainly because of the octasil technology that's built, that's incorporated into the wound contact layer, you can be guaranteed, or you can be confident, that you're going to get that really atraumatic and gentle dressing removal. So it's not going to disturb that new epithelial or very fragile tissue. So certainly it would be appropriate for patients that have got very fragile skin, but across the board as well.
Okay, great. The next question is question 4. This is for you again, Fiona. This is from Anne-Marie. And she says, sorry if this has already been asked, is the dressing suitable for use under compression?
So yes, absolutely. It can be used under compression, and we have data that supports how effective it can be used under compression. Again, if anybody would like some further and more in-depth information about that, please feel free to get in touch. We're more than happy to share that independent data with you to support your using this product under compression. No problem.
Okay, brilliant. The next question, this is for you, Charlotte, is with the pandemic, we are unable to evaluate new products at the moment. Do you have any real world data that may help us review this product easier?
Yeah, absolutely. So as you know, Suprasorb P Sensitive is very new. It's not been around for that long. However, there are a couple of quite a few sites who have already adopted the product and are using it. So we shared some of the feedback from the Isle of Wight, and we have some other sites as well, which are more than happy to share feedback with you. As I said, we also have some amazing independent data on file as well, which can really support when looking at making these sorts of decisions with, maybe your tissue viability team or your procurement team. So yeah, absolutely, get in touch, and we'd love to work with you on that.
Yeah, and there's a follow-on question here as well, which is in the same vein, which is, would you help me evaluate this with a patient?
Yeah, absolutely. Even with the current situation, we are still running evaluations. They're just kind of set up in a bit of a different way, so we can do them where we can get some product out to you. We can discuss which patients would be suitable, and yeah, absolutely. If you want to get in touch, we can put you in contact with your local representative and get that organised.
Excellent. Fiona, a question for you about the dressing here. This is from Quinder. Is it compatible with all primary dressings?
Well, so in terms of you would use so in terms of a prime dressing, I think that would be something that I'd probably have to double check, but certainly, it would perhaps be used in conjunction with the gel dressing, or if you're using a gel within a cavity wound, and then using your Suprasorb P over the top of that, that's absolutely fine. But generally, for a wound that was quite superficial, we wouldn't really recommend that you would need a primary dressing, because of the octasil wound contact layer that acts as a primary dressing itself. So generally we wouldn't be combining two different types of wound contact layers together, for instance, or an alginate and a wound contact layer, and making those sort of sandwiches of dressings. So the dressing itself will do what it needs to do in order to provide that optimum wound healing environment. And if you were needing something else to perhaps debride more difficult or adherent slough or devitalized tissue, then or the wound was a cavity wound, then we would look to see whether the dressing that you're using would be appropriate to use with Suprasorb P Sensitive.
Yeah. So the next question is from Norma, and this is does it come in borderless? So either one of you want to take that?
Yeah, thanks, Alec. Hi, Norma. Thanks for your question. Yes, it does. So we have the border range, we have a border light range as well, and also just no border. So yeah, we have a full range available.
Excellent. So there's another question here, which is what is the cost of these dressings? So for you, Charlotte, and that's from Nikki.
Thanks, Nikki. So as we shared with you, or as Fee shared with you earlier on in the session, we're really competitively priced. So it is, it wouldn't only be a quality switch view, it would also be a cost-saving move as well. If you want to get in touch after the session, then I can share with you a full sort of price list and look at a cost table with you. But just to sort of, just to know it's really well competitively priced.
Okay, thanks for that. It's worth pointing out as well that after this event, the recorded video of today's session will be available via our website, and alongside that, we'll put documents and links to be able to get any of the evidence that you were talking about, and we can probably put pricing up there alongside that as well. The next question, which is for Fiona, I think. Can you use this direct on partial thickness burns that is now sloughy?
Yes, there's no reason why you can't use it. The octasil layer obviously is very gentle. It certainly can be used on partial thickness burns, and actually, again, because of its ability to increase the natural autolysis that occurs within our own bodies, and in terms of wound debridement, it certainly, by providing that moist wound healing environment, will help that autolytic debridement of the wound that may contain sloughy tissue. I hope that's answered the question, has it?
Yeah, I think it has. Maybe a follow-on from that as well, because obviously we're talking about the contact layer that's on the dressing. Somebody's asked, what actually is octasil? Did
you want me to answer that?
Yeah, I think so, if you don't mind.
Yeah, that's fine. So octasil is Suprasorb P sensitive's wound contact layer. So it's actually as we saw through the presentation, it's the first layer that comes into contact with the patient's wound and the peri-wound tissue. And it's the unique combination of the perforation size and the distribution of the perforation that also is combined with silicone oil. And it's this combination that really helps the sort of the very gentle and atraumatic removal for patients in terms of when we're removing the dressing, but also that it provides, it still has a sort of a gentle adherence that keeps it intact and in place on the wound bed and the peri-wound tissue.
Okay, thank you very much for that. We've got a few more questions coming in, but if you are still watching, if you want to send anything in, if you want to ask us any more questions, then please do so. We're here for another few minutes. I think we've asked this one, or a version of it. The question is, can the dressing be cut? For Fiona.
Right. Yeah, I don't think we have actually answered that one, and it's a really good question. Thank you. So the non-border variety can be cut if desired. However, the border and border light versions shouldn't be cut, as they contain that external backing that really encapsulates the layers. So of course, if you start cutting it away, your layers are all going to start to fall apart. So certainly the non-border variety could be cut, but the bordered and the border light, no, we wouldn't recommend that.
Okay, and that's because of that's obviously because of the contact layer. You damage it.
Yeah, it would. The dressing, as you'd expect, the layers would start to, come apart. You need that backing, that external backing, to, it holds all that dressing together, really.
Brilliant. So question number 13. This is from Gladys, and we'll stick with you for now, Fiona, if you don't mind. This is: does this dressing cause skin tears during removal, as most sticky dressings do to thin skin?
No.
Of course. Yeah, it's a long question.
Yeah, no, it shouldn't do. As we said, you know, we've got, you know, sort of independent, really robust independent data in terms of not just the exudate, but also the dressing's ability to be removed and to ensure that atraumatic removal, so that it doesn't damage any, you know, sort of very fragile epithelial tissue or fragile surrounding tissue. And that's because of that octasil wound contact layer, because it's, you know, it's the whole of the first layer, if you like, included in the border of the dressing. So the border isn't different to the rest of the dressing. It's all made up of that octasil wound contact layer. So that really does give you confidence that it's going to be able to be removed, you know, very atraumatically. One, that it's going to ensure that we don't get any we wouldn't get any skin tears or damage, but also that it's comfortable upon removal for your patients.
Yeah, and I think I've seen in the past quite a few times when it comes to skin tears and foams and softer dressings, it's about making sure as well that you're removing them in the right direction, isn't it? So
yeah, and actually that's a good point to make, Alec, because silicone foams are generally indicated as a, you know, as a sort of first aid dressing in terms of managing skin tears. But again, you know, ensuring that, you know, that you usually got like an arrow on so that people know which way to remove the dressing, you know, so that we don't disturb the flap if the flap's still in situ. So they are used quite widely for skin tears, definitely.
Yeah, Charlotte, here's a question for you. I think this is quite a good question. Why is it called Suprasorb P sensitive? I always think that some of the random names that all companies use for their dressings is always something that interests me. So why is it called Suprasorb P sensitive?
So the P stands for polyurethane, and sensitive, it just means it's, you know, it's not only suitable for sensitive skin, but it's suitable for a wide range of skin types. But it's absolutely, you know, it's brilliant on sensitive skin because of the octasil technology. So yeah, it's a bit of a long one, but it's certainly memorable, isn't it?
It certainly is, yeah. Next question, this is for you again, Charlotte. This is, how do I get in contact to find out more information?
So you can contact your local representative, or you can contact Fiona, or if you, you know, share your details at the end of the session today, then, you know, we'd love to reach out and contact you, whether that's with regards to looking at an evaluation or to get your hands on some samples to have a go with a demo. Yeah, we're all here.
Yeah, and there will be links on how to contact you in the comments section, and also for those of you who are going to download a certificate after the event, there's an option on there for you to give permission for us to share your information, so that somebody from L&R can contact you about the dressing if you want more information. So keep an eye out for that. Question from Norma. This is for Fiona. So this is, do you have any advice on using on fungating wounds?
Again, there's no reason why you couldn't use this dressing on a fungating wound. I think in terms of fungating wounds, they very often are quite highly exuding. So I think it would really be based upon how much exudate is being produced. And sometimes in terms of malodor, we may need to be considering a dressing that's going to help absorb some of that malodor, obviously to improve, you know, your patient's quality of life. But there's certainly, again, nothing within the octasil wound contact layer that would mean that you couldn't use it on a fungating wound, you know, as far as I'm aware.
Okay, thank you. So there's another. There's a final question. I think we've definitely answered this. This is from a vet, and it says, can the dressing be used over a contact layer? So maybe if you want to maybe just clarify what you mentioned earlier, Fiona, that would be good. There's no reason to use another wound contact layer beneath Suprasorb P sensitive, because it does contain the octasil wound contact layer. It's already part of that dressing. So not only, you know, are you avoiding using different dressings, you know, it's sort of wastefully, I suppose, by having to think that you've got to use another wound contact layer. So please, you know, no, you don't have to use a wound contact layer. And I think that's also really important when you think in terms of
budget, you know, the cost of that complete dressing change. So using something like Suprasorb P sensitive that not only has that really cost-effective price, but also you're actually avoiding the need to use a separate wound contact layer, hence, you know, making a more significant cost saving. Oh. Hello. I think we've lost Alex. Alec? Yeah. Sorry about that, everybody. I think we've lost Alec. That was not expected. Obviously was. Oh, here he is. He's back again.
I think my internet just died, didn't it?
Oh dear.
I'm not sure if are we still live? I think my internet just died. So I do apologize for, I was just talking to myself for a while there and realized that the screen was frozen. I was thinking, is that me or is that you? So I'm not quite sure where we got to, but that's the end of the session. I was just thanking Eleanor for supporting this event, and specifically to you two, Charlotte and Fiona, for a wonderful presentation. These are a very interesting way of being able to replace the usual rep visits, as we said. So hopefully everybody watching at home has enjoyed the session. There will be links available on your screen now to get samples and also to download your certificate. That is it for me. I'm all sort of slightly flustered now. I've frozen. Enjoy the rest of your day, and thank you again. Cheers.
Thanks, everyone.
Thank you. Thank you. Bye.